Hi, family and friends near and far. Today we are talking about what high blood pressure is, why it is important to control it, and what you should be eating to better control high blood pressure. What is blood pressure and high blood pressure, known as hypertension? It is a measurement of the pressure placed on the blood vessels, especially as blood is pumped into and out of the heart. Hypertension is diagnosed when the systolic or top number is greater than 130 mmHg and greater than 80 mmHg. Normal range is 120 over 70 mmHg. What causes high blood pressure? Genetics, smoking and excess alcohol, poor diet, and high sodium intake. Why is it important to control blood pressure? First of all, it is important to go to the doctor every year for a physical and monitor your blood pressure levels. Most people with high blood pressure don't know it till it's too late. Hypertension, left untreated or uncontrolled, causes strokes, heart attacks, kidney failure, and disease. Controlling it with medication, changes in diet, and exercising reduces the risk and may even reverse the disease itself. In my career as a dietitian, I am seeing an increase in young people with chronic diseases. I work in dialysis with patients who have kidney failure disease. A major factor that causes kidney disease is high blood pressure, among other factors. Unfortunately, I am seeing younger people on dialysis and with strokes. Approximately 30% of my population is 50 years of age or younger. I can't express enough how important it is to take care of your body to prevent and delay chronic diseases. The only repair for kidney disease is a transplant and prevention. Which path will you choose? New research. People are exceeding the daily recommended value 2,000 milligrams or 2 grams of sodium a day with an average intake of 3,400 milligrams per day. Nearly half of Americans 20 years and older now have high blood pressure as cited by the American Heart Association. Children are even shown to have high blood pressure in part to the increase in obesity. That sounds pretty problematic to me for the future health of our next generations, especially with the rising cost of healthcare. It has been proven a high potassium diet can lower blood pressure and decrease risk of heart attack and stroke. Currently, the recommended intake of potassium is 2,000 milligrams per day. However, some research is suggesting a diet with the upper limit of 4,000 milligrams per day. So one may say, what are high potassium foods to include in the diet? Foods that have greater than 200 milligrams servings per portion. Higher potassium foods greater than 200 milligrams per serving to include apricots, dried, asparagus, avocados, bananas, beans, all kinds, beet greens, bok choy cabbage, Brussels sprouts, cantaloupe, collards, honeydew melon, kiwi fruit, mangoes, milk, mushrooms, nectarine, okra, peanuts, pear, pomegranate, potatoes and sweet potatoes, prickly pear, prunes, orange or orange juice, raisins, soy milk, spinach, tomato. This is a short list. Always remember, portion size matters. You could eat a smaller serving of a food mixed in with other foods to lower the potassium content. Or you can eat a larger portion of a particular food to increase your potassium intake. Examples of high potassium meal or snack. Whole-seeded grain bread, 2 tablespoons peanut butter, chia seeds, bananas, glass of soy milk, in coffee if you like. Total approximately 1,254 milligrams potassium. This is actually my favorite breakfast. Greek yogurt, chia seeds, 30 raisins, pecans, 1/8 cup oats, approximately 659 milligrams potassium. 1 cup oatmeal cooked in milk, 1 banana, approximately 1,457 milligrams potassium. 3 great breakfast choices after a salty dinner or day. Maybe we should start counting sodium and potassium in our foods instead of calories. I think people would be really surprised to see what they are actually eating. There has been a recent change in 2016 that required food labels to add potassium content of foods, so why not use them? Disclaimer, if you have kidney disease or any other medical condition that would be dangerous to eat a high potassium diet, definitely ask your dietitian or doctor if you can follow this food diet pattern. Action plan. Share what high potassium foods you ate in the comments. Thanks for joining. Your personal dietitian, Jessica. Author, The Quest for Family.